The first bill on the calendar for today is Senate File 476. The clerk will report the bill.
Senate File number 476, an act relating to state government, modifying policy provisions relating to continuity of care.
I recognize the author of the bill, the member from Hennepin, Representative Knorr.
Thank you, Mr. Speaker and members. This bill is the Human Services Policy Bill that improves the health and safety of patients in assisted living facilities, enhance protection for vulnerable adults, and also ensure that we have a program integrity in our system when it comes to medical assistance. Mr. Speaker, I do have a DE3 amendment.
There is an amendment at the desk. The Chief Clerk will report the amendment.
Knorr moves to amend Senate File number 476, the unofficial engrossment. The amendment is coded DE3.
I recognize the member from Hennepin, Representative Knorr.
Thank you, Mr. Speaker and members. Again, this is the Human Services Policy Bill. The Article 1 addresses the direct care and treatment policy areas. This ensures that there's protection for the employees when it comes to harassment from the patient and the clients. It addresses some minor technical changes and also addresses a few policy and budget continuation within the direct care and treatment. In Article 2, that is the section for the extension of those budget items for the advisory and also for the correctional and detention facilities. Article 3 describes the Department of Health policy sections. In Article 4, it's about the aging and disability services that covers a few things that I've just described previously. In Article 5, it's the behavioral health policy. And Article 7, those are policy changes in the maltreatment of vulnerable adults. And Article 8 is the continuity of care. And Article 9 is about the miscellaneous changes within the policy. Members, this is a complete package for the policy that our members have worked on, and also in consultation with the Senate to make sure that our bill is ready, and I ask for your support.
I recognize the member from Rock, Representative Schumacher.
Thank you, Mr. Speaker and members. I would also ask for support for the DE3 amendment here. There's some new language in here that I think the people who have been working on that should be happy with. We brought in a lot of stakeholder work to try and get agreement on things. As we talked to the Senate, as Chair Knorr had said, there were some things that had some controversy, but in the areas where people were willing to work together, particularly in the world of aging and long-term care, those pieces in which they were willing to work together to find resolve, we were able to get that language in. In areas where groups were not interested in working with the long-term care imperative or others, those provisions got dropped, and that's the way it should be in here. If we can't find peace in the valley, we shouldn't be advancing things. And so I'm glad to see that and glad for the people who are willing to work to get to a resolution a lot of these things, and glad for some of the redemption that comes along with some of that. Further redemption comes to the legislature in the work that gets put in through here. We see the non-cost provisions in this bill that help correct some of the decisions that DHS had made on its own over the last, through the interim last year, putting up guardrails on the processes, especially when it comes to fraud, and how we would want that to go forward so that we understand and providers understand when they're providing care what that service looks like, especially in cases of fraud. And so, members, I would ask for your support.
Any further discussion? All those in favor of the DE amendment? Oh, that's right. We have amendments to the amendment. The Chief Clerk will report the amendment to the amendment.
Kern moves to amend the Knorr amendment to Senate File number 476, the unofficial engrossment, as follows. The amendment is coded. The amendment is coded A8.
I recognize the author of the amendment to the amendment, the member from Ramsey, Representative Curran.
Thank you, Mr. Speaker. Thank you, members. The A8 represents a bill that we heard in Human Services Committee to take what some might say a creative look at how we operate or how we navigate human services programs. And the underlying bill that this amendment references would establish a legislative working group, and that would allow us to actually meet with people in the community, meet with stakeholders, listen to people who are served in the ICS program before DHS or the state decides to make changes without that much needed community input. It's unfortunate that what we're hearing right now is that DHS is working on their own version of a replacement program, but that remains without community input, without legislator input. I can pass it off if other members have comments at this time.
Further discussion to the amendment to the amendment. I recognize the member from Ramsey, Representative Curran.
All right, thank you, Mr. Speaker. The point being that we had a lot of really emotional, powerful testimony that was brought into the Human Services Committee this year. We know that it's really difficult for people with disabilities and those who care for them to make it here at the Capitol and tell us what works and what doesn't. I was hoping that this legislature would have that opportunity over the interim to work directly with people on a program that can work. It's my understanding, though, that it is too late to be able to make this change, and I regretfully will have to withdraw this amendment.
Representative Curran withdraws the amendment to the amendment. There is an amendment to the amendment at the desk. The Chief Clerk will report the amendment to the amendment.
Curran moves to amend the NOR amendment to Senate File Number 476, the unofficial engrossment. The amendment to the amendment is coded A11.
I recognize a member from Ramsey, Representative Curran.
Thank you one more time, Mr. Speaker. The A11 changes billing limits on individualized home supports with training from 6 hours daily to a monthly cap of up to 182.5 hours monthly. Last legislature, some changes were made sort of behind closed doors without community input that has put significant restraints on people who are using this service right now. And it is my hope that we will be able to continue moving forward so that families can access the services they need. We know that not everybody who needs services can predict exactly how many hours each day in a month that they might need. This gives the flexibility that people are asking for. I do understand that DHS has some concerns that there may be a small cost associated. So at this time, I will withdraw the amendment. Thank you.
Representative Curran withdraws the amendment to the amendment. To the underlying amendment, discussion. Seeing no further discussion, all those in favor of the amendment, please signify by saying aye. Aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's a motion at the desk. The Chief Clerk will report the motion.
NOR moves that Rule 3.33 relating to amendments must be pre-filed, be suspended for the purpose of offering the NOR amendment, the A13, to Senate File Number 476.
I recognize the maker of the motion, the member from Hennepin, Representative Knorr.
Thank you, Mr. Speaker and members. This is the technical changes that we got from the agency to make sure that the bill is in the right shape and addresses some few changes on the dates that are included in this amendment. I will ask for your support.
Any further discussion? I recognize the member from Rock, Representative Schumacher.
Thank you, Mr. Speaker. I would also offer support and ask for that support.
Any further discussion on the motion to suspend the rules? Seeing none, all those in favor of the motion to suspend the rules, please signify by saying aye. Aye. Any opposed, say nay. The motion prevails. The rules are suspended. There's an amendment at the desk. The Chief Clerk will report the amendment.
NOR moves to amend Senate File Number 476 as amended, and the amendment is coded A13.
I recognize the author of the amendment, the member from Hennepin, Representative Knorr.
Thank you, Mr. Speaker and members. As I noted, this is just a technical changes that we received from the agency to make sure that our bill is in the right shape, so I ask for your support.
I recognize the member from Rock, Representative Schumacher.
We'll try this again, Mr. Speaker. Good amendment, vote yes.
Any further discussion on the amendment? Seeing none, all those in favor of the amendment, please signify by saying aye. Aye. Any opposed say nay. The motion prevails. The amendment is adopted. There are no further amendments at the desk. The Chief Clerk will give the bill its third reading.
Third reading, Senate File Number 476, as amended.
Third reading. Discussion. I recognize a member from Blue Earth, Representative Frederick.
Thank you, Mr. Speaker. I just want to start by thanking Chair Schumacher and Chair Knorr. For a second year in a row, they put on display what bipartisanship looks like, and I think they did a fantastic job. So thank you both. This bill has a lot of good provisions in it. I'm just going to highlight three brief ones. One of the problems we were trying to address with this bill is in the Minnesota Sex Offender Program, people who have been civilly committed are using our state's data practice laws to be able to access data on the staff in those programs and then try to intimidate the staff based on the information that they get on them, like where they went to college. And so then they're going to those staff saying, oh, I see you went to a college at a certain space. Do you have family there? And then they're trying to intimidate and bully the staff. We close some of those loopholes with this bill. There's other issues where individuals who have been civilly committed, if they've been out for about 60 days, we are extending it to 90 days where they can come back voluntarily if something happened and they just need additional support for that small time frame. Maybe it's a little bit more than 60 days. We're giving up to 90 days now without having them to go through this whole big process again. And finally, the staff in the program, we are giving DCT the ability to move some staff from the unclassified to the classified positions. And so people who have potentially been doing the same job for the last 20, 30 years don't have to go through the application process all over again. This was something that was missed when we separated out DCT from DHS. So this is a good bill. Thank you to both chairs.
Further discussion on the bill. I recognize a member from Rock, Representative Schumacher.
Thank you, Mr. Speaker. Members, I would encourage support for this. I think that's been a word I've been using a lot this afternoon. And would just, crap, I was going to do it again. Just vote for the bill.
Further discussion. I recognize the author of the bill, the member from Hennepin, Representative Knorr.
Thank you, Mr. Speaker and members. First of all, I just wanted to thank the partisan staff who worked with us, Simon Brown, Marley Peterson, Megan Rosberg, J.R. Swanson, Rebecca Reines, Elijah Henderson, the pages Shelby and Henry, the non-partisan staff Sarah Sanderman, Danielle Pugnelli, Elizabeth Clarkfist, and also Doug Berg, who really helped us. And I don't want to forget the reviser's office for doing the amazing work to get the bill in the shape that we have right now. And to the members of the Human Services team from both sides for working together and putting a bill that works for the state of Minnesota. And I would like to thank my co-chair, Schumacher, who has been an amazing partner in ensuring that we take care of the people of Minnesota, that our system is there to protect those who need the most. Our systems are there to ensure that we do not forget about the vulnerable individuals, but also making sure that we put program integrity first and make sure that we're protecting the taxpayers' money. He's done an amazing job in getting us where we are today, and this bill addresses the gaps that exist in our policies to ensure that the continuity of care is available to those who need the most. And this is a good bill, and I ask for your green vote. Thank you so much, Mr. Speaker and members.
Seeing no further discussion, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Jones.
Jones, aye.
Jones votes aye. Kozlowski.
Kozlowski votes aye.
Kozlowski votes aye. Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 93 yeas and 39 nays, the bill is passed as amended in its title agreed to.